Hi everyone, this is Courtney from Prevent Blindness Wisconsin, and I'm coming to you today with day 2 of our 5 days of adult vision health series. So day 1, we really dove deep into the eye disease glaucoma. We talked about how it affects our vision health over time, but also too, if we have family history of it, how that serves as a risk factor for us potentially getting the disease down the road. Today, I'm going to talk about questions 3 and 4 on our adult vision health risk assessment. This has to cover eye injuries, eye surgery, and changes in vision over time. So this is going to be important for us because the more exposure our eyes have to surgery, treatment, also injuries, the greater our risk for some vision concerns, especially as we age. So questions 3 and 4 are, have you ever had an eye injury or surgery? And also, have you noticed a change in vision in the last 12 months? Now you guys will see that I have this bolded and in red, and there is a reason for this. I'm going to touch base on this when we go over this question in detail, but just keep that in mind, especially as you're following along with your risk assessment. So first I want to talk about eye injuries and eye surgery. Why is that listed on our risk assessment, and why does that increase someone's risk for vision problems over time? Well, eye injuries can cause a whole realm of issues, especially as we age. So one, they can cause damage to all of the internal structures in our eyes. So the lens of our eye, so that's why cataracts might form. So basically what a cataract is a clouding of the eye's lens over time. So if we have damage to that, that can cause clouding to occur a little bit more quickly than if it was just age related. And then we have glaucoma too as an example. So we're all glaucoma experts from day one, but I'm going to dive into how eye injuries might increase traumatic glaucoma in some people. Again, glaucoma is that eye disease or a group of eye diseases that affect that optic nerve, so that main communication system between our eyes and our brain, and it really affects those pressure levels in our eyes. First, though, I'm going to touch on cataracts and how eye injuries kind of play into the formation of those. So for us to see things clearly, all right, I have the anatomy of the eye here. It's a beautiful thing. So we have light that comes in through the outside of the eye here. This is called our cornea, the very outside. It passes in through the pupil, again, that black circle in the center of our iris. The light passes through the lens of the eye here. Ding, 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 here's our winner. Again, this is where those cataracts form over time. For us to see things clearly, we need light to come in just perfectly. We need it to pass through a nice clear lens and reflect on the back of our retina here at a nice sharp point. The sharper the point, the more clear and crisply we can see things in front of us. The kind of main giveaway here is we want this lens to be nice and clear. However, we talked about how cataracts, they cause fogging on that lens, okay? So if this doesn't become as clear as it should be, if it comes a little bit more opaque over time, light's not going to come to the sharp point that it should at the back of our eye. It's going to be scattered across the back of the eye. So that's why a lot of people with cataracts, common symptoms are reduction in our visual acuity of what we used to be able to see, blurry vision, hazy vision. We might have difficulty driving at night, reflection off of lamps, lights on cars at night might be very harsh for some people. So again, that cataract forms in the lens of the eye, and it causes it to become cloudy more quickly over time. So there's different types of cataracts. Age-related is going to be the most common. About 95% of adults will have a cataract sometime in their lifetime. Your eyes go through a lot in your lifetime. If the lens gets cloudy, it's very common for people to see that. Congenital cataracts is a cataract we see in a child, whether it is trauma during the birthing process, if they're born with a cataract, or if they get a cataract at a young age due to a hard blow to the head or injury to that eye. We do want to take that out as quickly as possible because the eyes grow and develop still as the child grows and develops into puberty. Traumatic cataracts, okay, this is where that eye injury really comes into play, you guys, especially with the risk assessment. So if we have a stick that gets shoved in our eye, or we get punched in the eye, or if we're very into sports and we get a hard blow to the head or a ball to the eye, that can cause a traumatic cataract. What's happening here is there's trauma to that lens, and that causes it to become more cloudy more quickly. All right, so if someone is 16 and say they get a baseball to the eye, they might have a cataract form maybe in their early 30s, maybe even before that, just depending on the severity of it because of that trauma to the eye. Secondary cataracts, these are a little bit more rare, but these are cataracts that are formed from a pre-existing condition such as diabetes. Okay, that increases our risk for cataracts to form a little bit more quickly in us than those that don't have it. So that is how cataracts can form from an eye injury or a hard blow to the head. Glaucoma, traumatic glaucoma can occur again if we have a very hard blow to the head or we have direct injury to the eye itself. And what's happening here is you guys will see again, here is that famous purple ciliary body at the top of the eye and at the bottom of the eye here. Again, remember here that aqueous fluid is formed. The aqueous fluid flows between the iris and the pupil, and it flows around here into the meshwork, through Schlemm's canal, and then into the rest of the body, into the circulatory system. If we have a hard blow to the head or the eye, what can happen is it can damage the ciliary body so it doesn't form the fluid at the rate it should. Fluid might not flow at the rate it should then from there. But also too, if we have damage here, we might have some broken blood vessels, some particles that leave that ciliary body with the fluid it forms, and they can get caught in the meshwork then. Then we start to see some cloggage occur. Might pass through into the canals, but then we might also see some clogs in the canals as well, increasing that pressure in the eye over time, which plays into that traumatic glaucoma from the eye injury. So it all plays together. Eye surgery, though, on the other aspect of that question, so anytime we do any type of procedure to the eye, going into the eye for surgery, it increases our risk for retinal detachment. So what is a retinal detachment? It's kind of this famous term, kind of put the fear in us to not have a detached retina. Well, what's happening here? And this image shows it beautifully. So again, you have the model eye. The retina is the very back of the eye, that very thin wallpaper structure, but it's so important in how we transmit light signals from our eyes to our brain. So what's happening here between the lens of the eye here and the retina at the back of the eye, what fills in that space here, you guys, is called vitreous jelly, all right? That helps fill the eye, helps keep its shape. So what happens is over time, whether it be an injury or surgery, any type of, process that the eye has to go through, what can happen is this vitreous jelly can actually pull on the retina, and the retinal detachment piece of it is the retina actually comes off the back of the eye. You can see that here. It's really kind of folding with that vitreous jelly, because this can have a lot of pull over time, especially if our retina is weak. It pulls it off of the back of the eye, and that's not good. We need that retina to be attached because, again, that sends those light signals, and it needs to be on that base, attached to that base. So different signs and symptoms of retinal detachment are a sudden increase in floaters. So if we have all of a sudden we're seeing many floaters, that's something we really want to get checked out. Flashing lights is another big symptom for retinal detachment. And also too, if someone does have a retinal detachment, they almost see a curtain in their field of vision. So one half of their visual field might be clear as day, but the other half, it just looks like a black curtain has formed, and that's where that retinal detachment might be coming off the back of the eye. So this, again, any type of surgery increases our risk. With cataract surgery, though, they really do have it down to a science nowadays. But again, any type of procedure and also any type of injury, too, can cause a retinal detachment over time in someone. So going into question 4 again, so have you noticed a change in vision in the last 12 months? Remember that one was that bright, bolded red question. This is something that we consider, if someone answers yes to this question on that risk assessment, we consider it an automatic referral. So if we see that yes is checked to number 4, we know right away that this person is going to be referred to an eye care provider after the screening is over. When we have a sudden change in vision, it is something that kind of raises a red flag for us. We just want to make sure things are healthy, things are functioning. It can be a sign that something's not right going on with the eyes, but maybe too somewhere else in the rest of the body as well. We can really put two puzzle pieces together to kind of solve an issue, but we need to make sure that we're acting quickly on it. So if you have noticed a change in vision in the last year, even in the last 6 months, 8 months, really pay attention to what that looks like. Is it worsening? Does it get better? Sometimes we really want you to have that conversation with your eye doctor. So if you notice a sudden change in vision, if it's happening more gradually, if it is becoming worse, we highly recommend to either call your eye care provider or make that appointment to get seen as soon as you can. Some symptoms of this might be sudden blurry vision, an increase in eye floaters, seeing those flashing lights again. So again, that can go into that retinal detachment, but it can also go into serious vision concerns as well, such as diabetes, retinopathy, AMD, if they have infections in the eye. That might lead to some vision concerns if they're not treated quickly. Prediabetes too can have a big effect on our vision health as well, and symptoms of this. So again, please just be aware of that vision health, what's normal for you, what's not, and if it's not normal, we highly recommend that you call your eye care provider and make an appointment to be seen. And again, we have to end with the dilated eye exam. So again, the biggest thing here is, are we going in regularly for a dilated eye exam? Again, that dilation piece, you guys can see the eye doctor can see the entire back of the eye and what's going on. Again, the optic nerve for glaucoma here. How does the retina look? Does it look healthy? Do we have some inflamed or unhappy blood vessels going on in the back of the eye? With an undilated pupil, we have a very narrow snapshot, and we might not be able to see things as clearly. We might miss a diagnosis that can really make or break seeing clearly for someone, especially as we age over time. So again, we really stress dilation, a dilated eye exam for adults, say between 18 and 40. If you don't have any risk factors, if you don't have any family history of vision concerns, we say about maybe every 2 to 4 years, even into 50s, every 2 to 4 years if you don't have risk factors or vision concerns. However, if they do run in your family, we do say, listen to your eye doctor, what is best for you. People 60 years and older, though, should be getting a dilated eye exam every single year, just because as we age, our risk for vision concerns does increase over time. So again, between 18, I would say maybe up to 50 to 60 every 2 to 4 years, and then 60 years and older, we do like to see that every single year for that dilation piece. So that is question 3 and 4. I hope you guys enjoyed day 2 of our adult vision health journey together. Day 3 is going to be covering dilated eye exams. Why is that piece important again? But also to covering other risk factors that present themselves, especially as adults age. I hope you guys enjoyed day 2. Stay healthy, stay well, and I will see everybody soon. Bye-bye.